Welcome back to the Senior Focus. I'm Nick Kaltzis, your host. I'm here with Renee Smith and Mark DiStefano. I said that we were going to talk a little bit about the different kinds of nursing care that someone can expect is possible. And what kind of nursing care? When I say nursing care, what kind of things can you do?
We do pretty much everything out of our Worcester office except for trachs and vents.
Okay.
So no tracheostomies, no ventilators, anything head to toe from, blood pressure assessments. If somebody's been having a lot of medicine changes, they see a cardiologist. The doctor would like to have their blood pressure, their heart rate monitored. We've been working a lot with podiatrists and wound clinics.
Yep.
We have a wonderful nurse who's wound certified that just joined our team. We work with a couple of orthopedic groups. Anything from wound care to just physical assessments, medication management. We do a lot. You and I have talked a lot about med reconciliation and how many of our seniors are over-medicated and how much medication errors contribute to rehospitalization. So our nurses focus a lot on that.
A surprising percentage of rehospitalizations are, like you say, because they either don't take their medicine, they make mistakes with the medicine that they do take.
Right.
Yes.
What we found, the trend is therapy. I mean, a lot of our patients receive therapy services. Even sometimes just a nurse will be ordered, and then once the nurse gets out there, they realize that really a therapist would help as well. Lots of the therapy, lots of his people are unsafe at home, frequent falls, people needing, adjusting to new adaptive equipment. I think the most important thing is that the clients that we see under skilled services, they need to meet the homebound criteria, which means they have to be, their absences from the home have to be of short duration and infrequently, whereas Mark's program has no such requirement.
One of the things that I thought was very noteworthy is a contractual relationship that you have with the PACE provider here in Central Massachusetts. Can you tell me a little bit about what you do for them?
Yeah, it was very exciting, Nick, that we signed that contract July 1.
Okay.
And we've been very active with that provider, bringing on cases of all lengths and for various states of assistance, such as I've referred to home health aides, homemakers, and companions. So we've done quite a bit with this provider.
So there's a whole range of services that you provide through, was it Summit Elder Care?
Summit Elder Care.
Right.
And you and I had talked a little bit earlier about how some of our clients will receive approved hours through the PACE program.
Right.
And supplement additional hours private pay.
Right.
So we have clients that do get hours approved by Summit Elder Care, but also are paid privately to have Bayada go in and do additional hours.
And the important thing is it's the same people that are providing the care, right? Both, through the PACE program, and also in the event you want to supplement the care that's being provided through PACE, it's the same people. There's an interruption in service or different people come in. It can be the same person, right?
Regardless of the payer, we strive to have continuity of care. And I think that's very, very important. Some of the elderly look forward to seeing a familiar face on a regular basis at a set time. So when we do bring on a new client, that is very important to Bayada, that we arrange, after a series of questions, the most appropriate personality, home health aide, homemaker to go into the home, and then try to keep that same one in place on an ongoing basis.
Earlier this morning I met with a client, and the husband came in, and his wife has a cognitive disability. It's a deteriorating situation, and right now perhaps it's not so profound and she can function okay. And I explained that, in the future, things are only going to become more intense, not, situation's not going to stabilize. I don't think that, the cognitive issues are going to go away or she's going to recover. if anything's going to deteriorate over time, it's going to become worse and worse. And they were interested in trying to, find whatever benefit is available and perhaps supplement whatever they get through the state and try to stretch out whatever resources are available to them. What you're talking about with PACE is precisely that, right? And not only can they stretch their resources, it's the same group of people that provide care through PACE or through private pay.
That's correct, and we have found working with Summit Elder Care and other contracts, other elder care contracts, that when we identify a need in the home, if the home health aide feels that additional time may be required to perform the duties, we elevate that back to elder services. And quite often they will approve additional time.
Okay. And how about the availability of someone if they have questions, whether they're private pay or otherwise, and they want to contact someone at Bayada? Can they contact them in the evenings or on the weekends or on a holiday, or is there a set specific period of time where phone calls have to be made?
All right, I'll jump in and take that. We are open, the office hours are Monday through Friday, 8:30 to 5. That would be the ideal time for someone to call in to have that discussion, because they're talking to either Renee, myself, one of the client service managers. We do have 24-hour, 7-day-a-week coverage of the phones because we have on-call. We have on-call managers who take calls, incoming calls, at night and on the weekends. But that discussion, specific to what you asked about, would be best suited for Monday through Friday, 8:30 to 5.
So if someone has a, we'll say, exigent circumstance, and they have a situation that's developed and it's 7 at night, 12 at night, 3 in the morning, there is someone at Bayada. They can pick up the phone and they can speak with someone, and someone can give them advice how to proceed.
Yes, absolutely. So the on-call managers actually are Bayada employees, and so they're very knowledgeable about the services that we provide. So if somebody is in an urgent situation and they're looking to begin home health services, they're not an existing client,
Right.
the on-call manager could definitely give them a lot of information.
Right.
If it was something that needed to be started as soon as possible over the weekend, that would be possible too. It might be, it would take some logistics,
Yeah, more
but
difficult but possible.
but it's absolutely possible. And for the skilled services, we have a nurse on call 24 hours a day. So if we're open to referrals around the clock, 365 days a year for our existing patients, and nurses available to give them advice or talk to them 24 hours a day.
All right, so that is an example if someone had something come up in the middle of the evening and they needed to place a call, there's someone that they could talk to. If there's an issue they want to discuss about physical therapy or some kind of therapy, I suppose that is an example of something that would be more appropriate for an 8 to 5 Monday through Friday type call.
Although
Would
I
not
would say that the on-call nurses are pretty knowledgeable about physical
Right.
therapy. So it would depend,
mean,
I
you
think,
wouldn't-
on the nature of the call.
Yeah. I mean, instead of calling at 2 in the morning and asking someone about physical therapy,
Yeah.
you might want to hold off on that call until the next morning, call during business hours,
yeah.
and talk to people
Those
there.
aren't the calls we usually get
Yeah.
at 2 in the morning, but we
Right.
do get them.
And I know we talked about it before, but just to stress, the range of activity that's available is what is necessary to provide a safe environment for the patient. So it isn't just medical care, it's non-medical care as well, and that's the assistive care division that you are the director of.
That's correct.
Okay.
Right. I think something just worth mentioning too is a lot of the assistive care programs in our area have time restrictions in terms of they'll only take private cases if they're like 3 hours or more, I'd say. And I don't want to speak to this for Mark, but I'm not sure that you have do you have a limit for, will you take a 1-hour case?
We have quite a few
If you can
one-hour
staff
cases.
it,
We have
okay.
quite a few one-hour cases, and we have the 24/7 that we talked about earlier in the program. So I would say the average length of most of our cases, Nick, are anywhere between 2 to 4 hours.
Right.
Not huge hours. It might be a couple times per day, but the average case may run just a couple hours at one time.
And let's talk a little bit about the 24/7 case that you have. There isn't any legal impediment or otherwise for someone to, for instance, contract or participate in the PACE program, have the PACE provider determine what they assume the needs of the person would be, what PACE can provide. You can provide the services through PACE, and then in the event that person wants more, like you said, the 24/7, they want to keep their parents at home, that's possible too, and it's with the same person. I really don't think that can be stressed enough.
I couldn't agree more, and that is fairly typical. They may start with a base of hours, but it tends to grow over time.
Right. And that's really, I would say, a rather unique situation, because in the line of work that I'm in, I always try to tell people, don't wait until the last moment. Do your due diligence. Get out there and see what's available to you. Don't wait for the last moment. If you wait for the last moment before you decide to implement some kind of plan, you're going to have so much emotional baggage that you're dealing with. It's going to be very difficult for you to compartmentalize, the decisions that you need to make. People really, I would think, ought to get out there and, investigate which care, which company they're interested in, which care company they're comfortable with. Do you see that is something that people are doing more and more often? Or do you think that they wait and then you get a phone call, there's an emergency, can you help us?
I think people are starting to shop around a little bit more. I know every time we come on here, we get a few phone calls afterwards. So I think folks are getting more educated and are taking a more active role. But I think sometimes when you're in that hospital situation and you're not feeling well and you're getting rushed out the door, and I think sometimes that's where...
When someone's in the hospital and, they're told, hey, you're going to be here for another 6 days, you're going to be here for another 5 days, the target date for your discharge next Thursday. They shouldn't wait until Wednesday, the day before discharge, to start, frantically hunting around. If you've got a week or so and it's coming and you're going to be discharged, look around, make appropriate accommodation so that when you're discharged, you have a plan in place.
Or ask a friend or family member
Yeah.
if you don't have access to the internet or if you're just not feeling up to it.
Right. I mean, everything that we do is, couched in terms of planning for the future, not waiting for the last moment. So as far as this kind of care, I think it fits hand in glove. Determine what it is that you need, make appropriate accommodation so that you can have as seamless care as possible from one environment to the next. In any event, we're going to head to our last break of the day right now, and I do want to talk a little bit more about discharge planning in the hospital.
Okay.